Good morning everyone, respected faculty and all my dear freshmen. We are the team of from roll number 71 to 18 presenting the seminar on post-hepatic jaundice. Let's see what is the jaundice. Jaundice is the yellowish discoloration of conjunctiva, mucous membrane or skin due to the increased bilirubin level in the blood. There are three types of jaundice as we discussed, that is pre-hepatic jaundice, hepatic jaundice and post-hepatic jaundice. Pre-hepatic jaundice, also known as hemolytic jaundice. In this jaundice, excessive production of bilirubin is occurs due to increased rates of RBC destruction. Then the hepatic jaundice, also known as hepatocellular jaundice. In this jaundice, failure or damage of liver to conjugate or excrete bilirubin produced in the normal amount. Then our topic is post-hepatic jaundice, that is obstructive jaundice. In this obstruction with the excretory duct of liver preventing the further excretion through the bile in intestine. That is the obstructive physiology. That is of intrahepatic and extrahepatic. Intrahepatic is due to the drugs or inflammation of biliary tract, or extrahepatic is due to the gallstone carcinoma or spasm of the bile duct due to the due to post-surgery effects. Let's discuss the post-hepatic jaundice with the help of small skit. In this skit, role of Pinky is played by Prajakta Chavan, role of Popatrao is played by Prathamesh Khande, and role of Doctor is played by Pooja Gode.
अगं बाळा किती अभ्यास करशील, बास की आता. अभ्यास करून कुणाचं भलं झालंय, बास कर.
हो बाबा झालंच. काय लोकांचे बाबा अभ्यास कर म्हणून मागे लागतात आणि माझे बाबा म्हणतात अभ्यास करून कुणाचं भलं झालं. चला हात पाय धुतला तुम्ही जेवण करूया.
माझं डोळं नीटच आहे की, तुझ्या डोळ्याला त्रास झालाय अभ्यास करून. दिवस आहे ते कष्टाचं काम करतो, रानात जातो, उसा बिसात काय तर लागला असं हाताला, एवढं काय तर दररोज नाही माझ्यासाठी. तुझ्यापेक्षा 4 पावसाळे जास्त बघितले ती. बापाला शिकवून काय करायचं. आता तू म्हणते तर जाऊया. काय झालं नाही मला हे म्हणून आलोय मी. पोपटराव. माझं वय त्रास काय ना, आत्ताच म्हणलं नाही का तुम्हाला, काहीच त्रास नाही मला.
symptoms are firstly it is occurred due to the blockage of bile flow in the accumulation of bilirubin in the body. Symptoms are yellowing of skin and eyes. Just we see in the patient, the doctor said that its nails are yellow. In the picture, first yellowing of skin and eyes happens. The dark color urine and the pale or flake stool found in the obstructive jaundice, itching occurs, and abdominal pain in the right upper quadrant of if the gallstone or tumors involved. Then the nausea and vomiting occurs, fatigue and weakness, mainly the weight loss and poor appetite, loss of appetite happens, and fevers and chills happen in this. Thank you.
आता लक्षणांवरून आपल्याला असं पूर्ण आपण निकाल नाही करू शकत. मी काही टेस्ट घेऊन देते तुम्हाला, तर टेस्ट करून आणा, मग आपण पुढे बघू काय करायचं.
एक टेस्ट करायला लागतं.
हाथ सरळ करा मूठ बांधा थोड़ा
There is prevent of normal drainage of the bilirubin to the intestine, due to which there the bilirubin level increases. Then about the alkaline phosphate, it acts as an enzyme marker. So you know the bilirubin is converted to urobilirubin in the intestine, but due to the blockage of the bile duct, so there is a prevention of the drainage of the bilirubin to the intestine, due to which there is an absence of urobilirubin in the urine. So this is the lab report.
काय झालं काय मला कळलं नाही. नक्की मला कशामुळे झालंय आणि काय झालंय ते सांगाय.
हा डॉक्टर मी झालं तरी कसं ते तरी कळू देत एकदा.
Now we will discuss the pathophysiology of post-hepatic jaundice with the help of small scale. When unconjugated bilirubin comes to liver, it gets converted into the conjugated bilirubin. But there will be the obstruction in gallbladder, so conjugated bilirubin cannot be excreted. Now the seminar on pathophysiology of post-hepatic jaundice will present the Prachi. So I will be continuing with pathophysiology of post-hepatic jaundice. The post-hepatic jaundice occurs when there is an obstruction of the passage of conjugated bilirubin from the liver cells to intestine. This condition is also known as cholestasis, which means the obstruction of the biliary flow. Then obstruction may be intrahepatic or extrahepatic. The extrahepatic cholestasis occurs due to blockage of the common bile duct by the gallstone, carcinoma of the head of pancreas, and the carcinoma of the duct. Then move to the metabolism. In post-hepatic jaundice, the rate of bilirubin formation is normal, but bilirubin form cannot pass from the blood to intestine. The conjugated bilirubin stills enter in the liver and becomes conjugated. So conjugated bilirubin excreted through bile duct cannot pass into small intestine. So eventually it regurgitates back into the blood, and this conjugated bilirubin starts appearing in blood. That's why urobilinogen not formed. If there is a complete obstruction of the bile duct, the urobilinogen will not form in the small intestine and it won't be excreted in stools. Similarly, urobilinogen will not excreted through kidney.
In post-hepatic jaundice, there will be the obstruction in the bile duct, so the conjugated bilirubin cannot pass into the small intestine, so it cannot convert into the urobilinogen, so urobilinogen absent in the post-hepatic jaundice. The conjugated bilirubin is water soluble and thus it cannot be excreted urine, so there will be a deep yellow color in urine. See, color of feces which is provided by urobilin will be lost, so here he will get clay colors too. Then main biochemical manifestations of the obstructive jaundice are there will be the increased plasma concentration level of the conjugated bilirubin and absence of urobilinogen, and then presence of bilirubin and bile duct, bile salts in urine, and there will be a raised level of alkaline phosphatase. Alkaline phosphatase is normally excreted through bile. Obstruction to the flow of bile causes regurgitation of enzyme into the blood, resulting in the increased serum level concentration. Thank you.
डॉक्टर त्याची मागची कारणे काय आहेत ते तरी बोलू द्या.
Now, Prathamesh will present the seminar on the causes of post-hepatic jaundice.
Now coming to causes of post-hepatic jaundice. The first is gallstones, which is obstruction on the common bile duct. And second, coming to the pancreatic cancer, which is especially in the head of the pancreas. And third is cholangiocarcinoma, which is the carcinoma or the presence of cancer in the bile ducts. Second is biliary atresia, which is the congenital absence or the absence in closure of bile duct. It mainly happens in infants. Now parasites. Some parasites such as liver flukes which are stuck into the bile duct and hence causes the post-hepatic jaundice. Now coming to the primary sclerosing cholangitis, which is the chronic inflammation due to scarring of bile duct. Colloidal cyst, which is the congenital cystic dilations of bile ducts. And last is the enlarged lymph node. Enlarged lymph nodes may be due to the malignancies or compressing of the bile ducts. Now, in this slide, I have summarized the causes of post-hepatic jaundice in the diagram. As you can see, the head of pancreatic cancer, cholangiocarcinoma, which is the cancer in the bile duct, biliary atresia, which is the closure of bile ducts, and primary sclerosing cholangitis, and at last, that is the enlarged lymph nodes. Thank you.
ठीक आहे डॉक्टर, हे कळलं आता कशावरून झाले, पण मला आता बाबांची जास्त काळजी वाटायला लागली. हे बरे तर होतील ना, म्हणजे याचा उपाय तरी आहे ना ह्याला काय नीट करण्यासाठी.
हे बघा आता ह्याला पोस्ट-हेपॅटिक जॉन्डिस दिलेलं आहे. ह्याच्यासाठी काय आपल्याला एकच मार्ग आहे, आपल्याला सर्जिकल प्रोसिजर. तर याच्यामध्ये ह्यांना ऑपरेशन करावं लागेल. मी तुम्हाला 7 दिवसाच्या गोळ्या लिहून देते, ती ट्रीटमेंट चालू ठेवा आणि 7 दिवसांनी आपण मग पुढे काय करायचं सर्जिकल प्रोसिजर त्याबद्दल चर्चा करू.
Now, the Pranay Bagre will discuss the treatment of post-hepatic jaundice.
So now we will be discussing the treatments of post-hepatic jaundice. So usually there is only surgical way for a cure of post-hepatic jaundice. There are two types of surgical methods. One is ERCP and other is Whipple's pancreaticoduodenectomy. ERCP stands for endoscopic retrograde cholangiopancreatography, which is used when there is a obstruction of gallstone, and Whipple's pancreatography used when there is a ampullary carcinoma or a pancreatic head carcinoma. As we can appreciate here, ERCP, the endoscope is driven through mouth towards the ampullary region of a duodenum, from which we insert the cannula.
Such as bile obstruction or liver disease. Some strategies include like lifestyle changes. It includes taking a balanced diet rich in fruits, vegetables, and whole grains. Then staying hydrated, drinking plenty of water to flush out the toxins. Then avoiding excessive alcohol consumption to prevent the reduced liver disease. Then some medical interventions include timely treatment of underlying conditions like gallstones, bile duct obstruction or liver disease. Then using medications to manage symptoms or treat underlying conditions, and undergoing surgery to remove blockages or repair bile ducts. Some other measures include vaccinations, getting vaccinated against hepatitis A and hepatitis B, then avoiding toxins, minimizing exposure to environmental toxins and chemicals, and regular checkups. Scheduling regular checkups to monitor the liver health. Thank you.